Dr. Ronan Glynn. Good morning.
Good morning.
Do you agree with Jim Breslin's assessment? One way or another, could we be haunted by this virus for years?
Well, notwithstanding the amazing or very good success, I guess, that we've had in the past number of weeks and months, and I know that that's not success for the people who've had this virus. It's not success for the families who are bereaved. That notwithstanding, the actions of people across Ireland and across society have saved a very significant amount of lives. But that notwithstanding, unfortunately, we still don't have a treatment. We don't have a vaccine. We don't have a rapid test. And until those things are developed and brought out in a mass way that can be used across the population, we will be living with this for the foreseeable future. Whether that's months or years is difficult to say at this point, but I think we are living in a new normal, and as we now set out to ease restrictions, it is very important that people continue to practice what I hope have become normal habits for them over the past number of months, including hand washing and respiratory etiquette and social distancing.
People may have read reports over recent days about vaccine tests. What's your assessment? Is there cause for optimism there?
There's certainly cause for optimism. We have seen an unprecedented level of research and activity around the development of a vaccine for COVID. The first phase 1 trials for vaccines for COVID commenced in March, and given that we didn't know about this virus in December, it really is unprecedented that the speed that this is happening, and that reflects research across the entire continuum of COVID. There's been over 23,000 scientific papers published to date. But that notwithstanding, again, the typical length of time for a vaccine to be developed is between 10 and 15 years. The fastest vaccine that's ever been developed was one for Ebola, and that took between 4 and 5 years. Now, I'm not sitting here this morning saying that it's going to take that long, but I think we do need to exercise caution when we hear some reports that we could potentially have a vaccine that will be available as soon as the end of the summer. Because even if we do have a vaccine that's safe and effective and produces immunity for a sustained period of time in people who receive the vaccine, it still needs to be produced on a massive scale, because every country in the world will want this vaccine at the same time.
As we heard earlier from Louise O'Reilly, it's likely that TDs in this new Dáil committee will ask about nursing homes today. Now, the latest figures published last night show that in the region of 54% of deaths have been in nursing homes. What went wrong?
Clearly, we've seen across the world that this virus, that this disease impacts disproportionately on elderly populations. Unfortunately, again, we've seen across the world that this virus gets into residential care settings, it gets into nursing homes with all of the terrible impacts that entails. Obviously, we continue to monitor what has happened here in Ireland, and we continue to strengthen the response. And as part of that, we are looking at mortality. And I guess one of the things I can say is that we have done a number of things that are unprecedented versus other countries in the world in terms of our nursing homes. So we've done a special census of mortality across our nursing homes. And what that has reassured us about, at least, is that any of the excess mortality that we've seen in those settings this year is associated with COVID. So there isn't excess mortality from a range of other diseases in those settings that we're not aware of. And there's very few, if any, other countries in the world that can say that. The other thing...
But for the first number of weeks, was insufficient attention paid to the situation in nursing homes?
I would contest that. We were one of the first countries in the world to introduce restrictions. In fact, we were the quickest country in the world to introduce visitor restrictions in nursing homes versus the point at which we had our first case. We moved quickly and we moved rapidly and comprehensively in terms of our actions. And as I'm sure you've seen the graphs, what's very clear is that this disease, as it is in all countries, it's in communities first, and then it gets into congregated settings. And we can see that that's exactly what happened here in Ireland as well, unfortunately. But there are learnings. We are learning. We have strengthened our response. And I guess the key thing as we move forward is that we protect the most vulnerable to the greatest extent possible.
We're now in the first phase of the easing of restrictions, and there are those, I'm sure you know, who think we're moving too slowly, certainly in comparison to some other countries. Is it possible that these phases, that they could be revised?
So, as we have done throughout this process, we follow the guidance of the ECDC and the World Health Organization, and they're both very clear that you should leave between 2 and 4 weeks between phases, and that the measures you release, you should do that in an incremental manner, in a stepwise manner. Our peak number of cases, so the top of our curve to date, happened much later than many other countries. So many other countries across Europe peaked at the end of March. We were well into April. And what that meant was that on the way up, it bought us time in terms of getting our PPE, in terms of ensuring that we had adequate hospital capacity, adequate ICU capacity. But now that we're on the way back down, it also allows us to learn from what other countries are doing, because again, they're ahead of us by a couple of weeks. And it really would be remiss of us not to take that opportunity to wait for an extra week or two to see what they're doing, to learn from what they're doing, and to ensure that if there are issues that arise in those countries, that we don't make those same mistakes.
All right, so are those plans, those phases, are they under constant assessment then? Could there be change?
So the NEFIT meets on an ongoing basis. It's been meeting weekly now for many months, and sometimes 2 and 3 times a week for many months. And clearly we keep all measures under review at all times. And that's with a view towards both the potential release of measures, but also obviously as we move forward, we also need to consider whether anything needs to be escalated in the other direction. And we really hope that we won't have to go in the opposite direction. And a key part of phasing this, a key part of doing this slowly, is to try to ensure insofar as is possible that we won't have to go into reverse, and that we can gradually learn to live with this disease, because as we started this interview by saying, we have to live with this for the foreseeable future. And so it's important that we do this in a stepwise manner, that people get used to the new normal, and hopefully we can avoid a second wave, a second spike.
Throughout all of this, obviously other serious illnesses haven't gone away. What's the situation now with vital screening services like cervical check and breast check? When will they be back?
So at the moment they're paused. The intention is that screening services and that other health services will get back up and running as soon as it's safe to do so. But as we sit here this morning, it's too early to say precisely when they will be back up and running. We have to think about both the safety of obviously the men and women who attend for those services, but also the safety of the staff who provide those services. What I would say though, if possible, is that no one should be waiting for a screen if they have symptoms. So if a woman is concerned that she has symptoms, if a man is concerned that he has symptoms, your GP is open. Your GP has been open throughout this process. They're there and they're waiting to assess you and to ensure that if you need to be diagnosed, if you need a test, that test can take place. Screening is an extremely valuable part of what we offer, but ultimately screening is to pick up asymptomatic disease.
But no routine screening for some time yet, is what you're saying?
Not for the foreseeable future, no, not at the moment.
Hydroxychloroquine, as I'm sure you've heard, is back in the news today after Donald Trump said last night that he was taking it. What's the advice here?
We have looked at this advice here in Ireland as recently as the middle of April, and it's very clear that there simply isn't an evidence base at the moment for hydroxychloroquine and the other drug that the President mentioned, which was azithromycin. So we would be telling people certainly not to consider taking any medications without the advice of their own doctor, and certainly from our perspective we'd be saying that there's no evidence of a protective effect from those drugs at present.
I know that Donald Trump has said in the past, what harm can it do? Could it harm someone?
Well, any drug has the potential to harm an individual. And again, without getting into the specifics of a particular drug or a specific individual, I would caution anyone against taking a drug without the advice of their GP in the first instance.
You're very diplomatic. Dr. Ronan Glynn, Deputy Chief Medical Officer, thank you for joining us this morning. It's 8:24.
Government formation talks between Fianna Fáil, Fine Gael and the Greens continue today, with Leo Varadkar and Micheál Martin committing to negotiate in good faith following a weekend spat between their two parties over election planning. Our political correspondent Paul Cunningham is tracking developments. We can talk to him now. Paul, the party leaders, Mr Varadkar and Mr Martin, apparently putting this row behind them.
Exactly. The weekend was